know it has certainly impacted students deeply in ways are still trying to understand and will take some time to uncover. But we know that one of the most devastating results is a widening health gap as a result of the pandemic. Can you share how you've observed this trend play out and how these two pandemics, COVID-19 and childhood obesity, are connected?
And the CDC has looked at data for, I think, over 400,000 kids, and they have seen a similar thing. So we're definitely seeing something that's particularly in these younger children, that's a call for action there, definitely. And then, of course, we have the fact that there's a triple whammy to all of this, that both COVID and obesity have this disproportionate impact in communities of color, right? So due to the social determinants of health, including poverty and structural inequalities, communities of color have been hardest hit by the pandemic and having to work more often outside of the home and on the front lines. And so in the short term, we've seen that they are already estimating that there's going to be a decrease in life expectancy that's 3 to 4 times more than the decrease we're seeing for white Americans compared to Black and Latinx Americans. And so this will widen that disparity in life expectancy. And we're seeing it already. We're seeing that there's an increase in the prevalence of type 2 diabetes and hypertension during the pandemic in communities of color that have already been at greater risk for experiencing negative outcomes because of obesity. And now on top of it, negative outcomes because of the pandemic.